You say. Thank you so much, Wendy, like say, for introducing the club to everyone today. I'm very honored to have all of you, some familiar faces, some of you people that I've in the context that I've yet to know and would love to know you better. We would we greatly appreciate your honor and your attendance today in our Venus, your participation. Today, we have a very special guest, Dr. Sharifah. She's a fellow gynecologist in one of the established hospitals, speaking on a very, very particular topic, endometriosis. I hope I'm pronouncing it right. Uh, so in that context, I think this is the part 4 of our health talk in our first series. Why we did this, this was brought down by the previous exco, is not so much about, pushing Venus or whatnot, but it's more towards creating the awareness, empowering women. That goes back into our vision, whereby we would love to empower women, regardless whether they are Toastmasters or not, to share our awareness and bring more value, women helping women, women power in that context. And in today's world, health, is one of the pillars, we would say. Your health, your relationships, you know, and of course, career, family is all part of it. So a lot of our members say health is one of the biggest pillars. So these are the sessions we did just to empower women, women-centric topics that we hope can bring value to all of you. And of course, today we are very honored to have our special guest who is an seasoned expert, that can actually spread the awareness, the value, and hopefully if this is, the message resonates with you or brings value, we hope also you spread the awareness further, because you will never know, like in the previous health talk that we mentioned, right? Somebody actually mentioned, I never knew I had all the symptoms that made me go and visit, a gynae to get better consultation. I think that ultimately reflects back into what we would love to do for the community and also Venus members, so that whatever it is, we want the better well-being for everything as a whole. So I'm more than excited to have all of you here. I'm very honored that you joined today's session. I hope that you have a valuable time information that you can take into action. But more importantly, like I always say, please have fun in this club meeting, and we hope to see you again. So over to you, back SAA or TOE of the day.
Thank you, President Crystal. Good evening, ladies and gentlemen, fellow Toastmaster, and guests. Hi, everyone. My name is Hui Ying. It's my pleasure to be your TOE tonight. Tonight's meeting theme is Strong Beyond the Surface. I just want to add on, no matter what kind of challenges, difficulties, or struggles you are facing right now or will face in the future, please stay strong. Please keep in mind that they are just the temporary visitors in our life. They won't last forever. They will pass one day. All right. Next, I will introduce the Toastmaster Club. Can I have the slide, please? Toastmaster International is a non-profit organization that helps people to gain confidence and public speaking skills. It is started by Ralph C. Smedley 100 years ago. Fast forward to today, we have more than 270,000 members all around the world in 150 countries. Next, our club mission is to provide a supportive and positive learning experience to help the members to develop communication and leadership skills, result in greater self-confidence and personal growth. Next slide, please. Venus Toastmasters Club. We are an all-ladies club. Our mission is to empower and to support women to improve communication and leadership skills. Each year, we have achieved President Distinguished Club 100% of pathway adoption and Triple Crown achievers. Next. In each meeting, we have prepared speech session by our members. Besides, we have impromptu speech session, or we call it as table topic session. It's the opportunity for everyone to take part and to speak without practice. For evaluation session, it is for us to get the feedback to grow and further improve ourselves. Next. Next, I will introduce the role players of tonight. Tonight, we have our timer, Michelle Ma. Can I have your introduction of your role, Michelle Ma?
Hi, Huyin. Thanks. Good evening, fellow Toastmaster and guests here. As a timer, I will time the table topic speaker, the formal speeches, and the evaluation. I will also alert each speaker of the time that they have left using the green, yellow, red cards, which denote specific times remaining. The table topic speaker should limit their remarks to not more than 2 minutes. For the icebreaker speeches, it should be 4 to 6 minutes in length, and most of the speeches should be around 5 to 7 minutes in length. That's all from my side. Thank you.
Thank you, Michelle Ma. Next, I would like to invite our R counter, Iwa Chin, to introduce your role. Over to you, Iwa.
Thank you, TOE. So, good evenings, everyone, fellow Toastmaster and guests today. So, the purpose of the R counter is to note the words and sound that used as a pause filler, by anyone who speak. During the meeting, I will listen for overused words, including and, well, but, so, and you know. I also will listen for the filler sound, for example, I also will note when a speaker repeat a words, a phrase, for example, or this mean. At the end of the meetings, right, I will give you a report of the number of the times that each speaker used this expression. Thank you. Back to you, TOE. Thank you.
Thank you, Iwa. Next, we will have our prepared speech session. Let us invite our speaker, Wendy Tan, and her evaluator, Yun Yiwen. Yiwen, can you explain the project objective of Wendy? Over to you.
Thank you, Huyin, Madam TOE. Tonight, Wendy is attempting her Level 1, Project 2, Writing a Speech with Purpose. Her pathway is Presentation Mastery. The purpose of her project is to learn or review basic methods for writing a speech with a defined purpose and to present a well-organized speech on any topic. And her topic tonight is Different, Not Broken. Wendy Tan, Different, Not Broken. Over to you.
Okay. Thank you, Ewan and Queen. Good evening, fellow Toastmasters and guests. I'll start my speech now. Have you ever had someone you know who seems to struggle with making friends or prefers being on their own? Sometimes they appear blunt, rude, or not interested without meaning to. They find it hard to understand what others are thinking and feeling, and often get very anxious about social situations. Today, I would like to present to you the topic on autism. Autism comes in different levels and often not diagnosed in females. Unrecognized autism in females can lead to exploitation because they have social challenges in understanding social cues and navigating complex social situations. Identifying whether females have autism early can help protect them from future harm and enable them to develop healthy coping mechanisms. In general, autism can be categorized into 3 levels of severity: level 1, level 2, and 3. This level doesn't mean that one level needs more help than the other, but that they require different types of support. Levels of autism tend to be harder to identify in females, especially those with less pronounced symptoms or effectively mask their traits. Autistic individuals categorized in the first level may experience some social communication difficulties and some repetitive behaviors. Making friends is a struggle, and they would rather engage in solitary activities, but they can maintain friendships and participate in social events. YouTuber Morgan Foley, who has level 1 autism, shared that giving compliments to friends can sometimes come across as snarky or sarcastic. She might look someone up and down and sincerely praise their style, but her non-verbal actions, such as scanning someone's appearance, make them think that she's making fun of them, when in reality, she means no harm. Autistic individuals categorized in the second level, they have more noticeable difficulties with social communication and repetitive behaviors. They might struggle to understand sarcasm or jokes, leading to misunderstandings. They may have difficulty initiating conversations or maintaining eye contact. They might need help managing their daily schedule or dealing with unexpected changes. Autistic individuals categorized in the third level tend to have severe impairments in social communication and repetitive behaviors. For example, they might be nonverbal and need significant assistance with dressing, eating, and other self-care activities. Autism in females can present differently than in males. Research suggests that adult females and girls are more likely to mask their symptoms. This is especially common among females at the level 1 end of the ASD spectrum. The common forms of masking include forcing themselves to make eye contact during conversation, preparing jokes or phrases ahead of time to use in conversation, mimicking the social behavior of others, and imitating expression and gestures. Females with autism may also have different interests compared to their male counterparts. Males with autism often have intense interest in specific topics such as trains or technology, but females with autism might have intense interests that are more socially acceptable, such as books, animals, or celebrities, which can further obscure the diagnosis. While masking can help females with autism navigate social environments more smoothly, it often comes at a significant cost to mental health. Consistently pretending to be someone else can lead to confusion about one's true identity and a diminished sense of self. Aileen Partlow, an autistic therapist and advocate speaker, shared that she spends more time dissecting the human experience rather than having one herself, making her feel disconnected to everyone around her. The ongoing effort to monitor and adjust behaviors lead to heightened anxiety and chronic stress. They are feeling to be unable to be authentic, and the ongoing strain of maintaining a facade can contribute to feelings of depression and low self-esteem. Recognizing and addressing the practice of masking is crucial for the mental well-being of females with autism. To sum up today's topic, we learned that there are 3 levels of autism, with autism in females often going undiagnosed due to their ability to mask symptoms. Unfortunately, this can have serious negative impacts on their mental health. If you or someone you care about shows signs of autism, especially if they interfere with daily life, an early diagnosis and intervention can significantly improve quality of life. Even mild symptoms, when properly understood, can lead to better self-acceptance and improve mental health. Thank you. Back to you, TOE.
Thank you, Wendy, for your speech. From your speech, I learned that we shall appreciate, or take care of our mental health. And if you or your friends face this problem, please seek help from the professional. Next, we will move into our table topic session. Let's welcome our topic master, Junde. Floor is yours.
Thank you. Can you hear me?
Yes.
Yes, right.
Yes.
Okay. Hi. Thank you, our TOE Toastmasters Hui. Fellow Toastmasters and welcome guests. Table topics enable everyone here to develop the skill of impromptu speaking. So it trains us to quickly organize and express your thoughts. So you can think about table topic speech is like a mini speech, whereby you have an opening, body, and also closing as a conclusion. So this also provides a speaking opportunity for any members who are not having any roles for today. And I also wish some of the guests today can also participate together with us. All right, so let's set some rules about these table topics. Each speaker is required to speak for 1 to 2 minutes. Okay, so you will be disqualified at 2 minutes 30 seconds. All right, so if everyone is ready, perhaps I can encourage everyone. Tonight, I would like to maybe share my screen first, just to set. This is going to be a little bit different from what we used to be or used to have. Okay. All right, I'm sure you can see my screen now. Okay, so let me explain a little bit. This game is called Before and After. So how does it work? So I will choose or you will choose some of the topics that you see, and it will start with before and after. All right, there's a situation. So I will give you a before statement and also an after statement. So in the middle, it's where you can fill up or you want to say anything to showcase what had happened, or you can actually have a twist, or you want to be creative about your speech. Okay, so I have 6 topics that are ready. So I can't see the screen, anyone that write into the chat box. So I would appreciate if you can just shout out your name and if you want to be the first volunteer. Anyone? If not, I'm going to call the names. Anybody? Okay, let me call names. Haha. I will start with maybe a Toastmasters member first. Betty? Betty is our very seasoned Toastmasters. Betty, are you there?
Yes, yes.
Okay,
Yes,
Betty.
June.
Sorry, I think I have, do you still see my screen?
Yeah.
Okay, hang on. Oh, okay, Betty, please go ahead, choose one of the superhero that resonate to you.
The top on the left.
Top on the left, Superman?
Yes.
Okay, all right, this is in the cinema, now it's playing. Okay, so let me choose your topic, yeah? Oh, okay. Sorry, some technical issue. Maybe it's not moving from me. How come it always happen to me? Okay. So can you see this? Oh. Okay, Betty. Before is you lost your job unexpectedly. After is you started your dream business. Betty Pua. Betty Pua, before you lost your job unexpectedly. After you started your dream business. Over to you.
Thank you very much, June. I lost my job unexpectedly. And this is something that it is really heartbroken when the company announced a layoff. For those people who have been working for too long, and the company is striving to reduce the management cost. And this is for the reason that they need to lay off some of the old staff. And unfortunately, I am among those being listed. So it is really unexpected. Now, ladies and gentlemen, I am sure this is happening when times are bad, and the company will really have got to strive to make the company moving within the cost and within the budget. Now, what do I do when this is really put on to me? I would take it in my own stride, and this is where my advice to all, the preparation when you are already near your 50 over, this is the time planning has got to come by, because you just have got to face it. Our time will come when it is near retirement. Don't just wait and see the company will serve and give you the job satisfactorily to yourself until you are 65 or 60. So planning is very important. Fortunately, I have done the planning before, even financially, spiritually, and emotionally. You got to get this ready. And this is something that even for insurance, we have got to make sure that we are also prepared. Don't think that the company will pay for all your medical expenses. And when it comes to the starting of your dream business, it's also good to plan whether you want to do on your training Don't wait until you are laid off, then only you start planning. This is very bad. So I would urge everyone to make sure that this message is right and clear so that we do our planning beforehand. So I hope this little gist can give you the spark to get yourself moving. Back to you, June.
Thank you. Thank you, Betty. So Betty gave us a reminder, everyone. Actually, not only when you reach 50, you need to have your career planning. In fact, for me, I think you can do any planning at any point of your time, of your life. So perhaps it's your career shift, or also you want to take up a bigger role, or you want to have a break in between. So I think the key, what I learned from Betty is don't wait or depends on other to plan, but plan it for yourself. All right, thank you, Betty. So I would like to share my screen one more time. Okay. So, all right, anyone who would like to take up the next table topic? If not, then I will call name again.
May I give it a go, please?
Okay, what's your name?
It's Sarah.
Sarah. Okay, Sarah. Sarah, well, what superhero that you would like to pick?
May I go for Spider-Man, perhaps?
Spider-Man. Okay. Sorry. Okay. All right. So, Sarah, before you spill coffee on your boss after you got promoted. Before you spill coffee on your boss after you got promoted. Sarah, over to you.
Right. So I spilled coffee on my boss. Here's the story. I was a worker in the company, and frankly, I was quite a new employee at that time. Well, of course, being a new employee, this means that you are often given the more menial tasks, as usually people in your department don't really have that full trust in you as if you were someone who was more experienced, right? Therefore, one of my tasks, unfortunately, involved fetching coffee for my fellow co-workers in the morning. So every morning I would be in the pantry, boiling the coffee and leaving the pot there for anyone who would like to have a cup. Unfortunately, this one morning, my boss happened to be in that pantry while I was boiling that coffee. And honestly, I'm not entirely sure what happened in between. All I remember is one moment I was holding the pot, the next moment
Is Sarah freezing? Suspense. Oh, Sarah, we lost you.
This is like the most ultimate moment you have an advertisement.
Okay, so situation happened. Perhaps I will want to maybe take the next topic first, then let her come back. Is it okay? Yeah, right? Okay.
Okay.
Okay, so I will share my screen. I need a next volunteer. Anyone? If not, I will call name again. How about Shamin Kok? I think he's one of our guests. Shamin, are you there?
Hi, yes, I'm here.
Hi, yes, we still have 4 more topics to go. Would you like to
Okay,
pick one?
sure.
Yeah.
Sure.
Choose anyone? Or I'll choose for you.
Okay, I'll just go with Iron Man.
Okay.
Yep.
So here you go. before you failed your first driving test twice after you became a Grab driver with a 5-star rating? Kareen, yeah, over to you.
Okay. Sorry, can I see the question again?
Oh, okay. Sorry. So it's something like, let me read that out.
Okay.
You failed your first driving test twice.
Okay.
And after is you became Grab driver with 5-star rating. All right?
Okay, so I just have to tell a story, right?
Yes. That is
Okay.
the opening and there's an end.
Okay. Okay, so before I failed my driving test, and after that I earned a 5-star.
You are a Grab
Okay.
driver with 5-star
Okay.
rating.
Okay. Oh, this
What
is
a twist.
tough. Okay. So I've actually earned unemployed staff, and so I've decided to join doing Grab. And while I was driving Grab, I actually received a lot of complaints from due to my car condition. So I've actually met a very lucky driver while I was picking up a passenger. And he actually told me that, oh, is Sarah would like to speak, or
No.
okay.
Carry on.
Okay. So before that, I've actually met a very lucky passenger. So we've actually connected on health issue where she actually has endometriosis. So she actually shared me her experience on going endometriosis, and we actually bonded from there. And I also shared her my condition. So she was very happy to have a friend to speak to because she shared that nobody could actually understand the pain that she was going through. So I was also happy to share my experience with her, and also me before when I was unemployed, I was working in the healthcare industry. So I was able to understand her better and also give her some solution and suggestions to be referred to the right practitioners that we have in Malaysia to get her the best possible healthcare. So right after that, before I dropped her at her location, she actually gave me 5-star review for thanking me to give her such good solution, and also to be able to understand her on a friend level, not just as a driver, but also as a close friend and confident. Does that make sense? Yeah. Yep. I'm done.
Yeah. Good job,
Thank you.
Charmaine. So I like how you actually stand on your own feet. You're able to actually connect the drivers, and also you throw in the topics where our talk is related. So actually to make that storyline. Thank you so much.
Thank you.
All
Thank
right.
you.
So why don't we put our spotlight to Sarah? Sarah?
Hello, yes, sorry, I got disconnected.
Oh, no problem. Okay, so we are actually halfway hanging on your story. Could you just carry on? You said you spilled the coffee, right? Yeah. What's
Yep.
happened next?
What happened next was my boss saw how professionally I conducted myself despite the mistake, how I made the effort to rectify it and tried to fix my mistake by handing him tissues and helping him to clean up and all. And that became the starting point of him paying more attention towards me. Oh, eventually, he started giving me more and more major tasks, which really helped to accelerate my career and build my skills, which eventually helped me to get that promotion that I always wanted. So, yeah, that's all from me. Thank you very much.
Okay,
Just a
well
quick
done, well
summary.
done. Well connected. So you actually use that the boss actually spotted how calm and composed you were when situation happened, and giving that as an opportunity for you to grow and shine in your career. Well done, well done. Thank you, Sarah. All right, so we have, I just want to check with the timer. Do we still have time?
Can we interrupt it for a bit because I think Dr. Sharifah would love to begin the sharing.
Oh, okay. So, all right. So I think we'll end our table topic session. Hand it back to you, Teo Hui. Thank you.
Thank you. Thank you, Junbei, for your innovative table topic session. It's so creative. So, may I know? Actually, we shall have a break right now. Shall we?
Sorry,
Okay.
Teo, we're supposed to have,
Okay.
I think, the group photo, right? First.
Right now, we will proceed with the health talk session first.
All right.
Okay.
Okay.
Maybe we can hand over to Anisha for the introduction.
Over to you, Anisha.
Thank you, Toastmaster of the day. Good evening, everyone, and welcome to this special Women's Health Talk. We are glad to have you here tonight as we shine a spotlight on the condition that affect 1 in 10 women, yet often goes undiagnosed or misunderstood, endometriosis. Tonight, we are truly honored to welcome Dr. Sharifah Halimah, one of the Malaysia most respected specialists in women health from Picaso Hospital. Dr. Sharifah is a senior consultant, obstetrician and gynaecologist with over 29 years of experience in managing a wide range of gynecological conditions, from routine care to complex surgical cases. She is especially known for her expertise in endometriosis and adenomyosis and large uterine fibroid, and in highly skilled in advanced laparoscopic and minimally invasive surgery. Dr. Sharifah holds multiple postgraduate degrees, including a Master of Medicine in obstetrics and gynecology, and 2 master degree focusing on anatomical landmark and the surgical management of deep endometriosis, both from the UAE. She's also a certified robotic surgeon trained under the Da Vinci surgical system in Korea. Beyond her clinical achievement, she's deeply passionate about improving women's health outcome through education, awareness, and surgical innovation. So whether you are here to learn more for yourself, support someone you love, or simply gain your awareness, you are in the right place. Let's get ready to uncover the truth, clear up the myth, and better understand what our body are trying to tell us. Please join me in giving a warm welcome to Dr. Sharifah Halimah.
Thank you. Thank you very much, Anisha. Such an elaborate introduction. And thank you very much for inviting me to share my thought about endometriosis. And nice to meet everybody. Well, not face to face, but virtually, but almost feeling the same. Okay, so without further ado, I will just continue share my. If you can allow me to share the. Can I share? You see? Can you see?
Yes, doctor, we can see.
Oh, okay. All right. So, okay. Right. So, right.
Doctor, you
Okay.
don't mind? Can you put it on full screen? Thank you.
It's full screen, right?
Uh,
It is.
Yes.
Yes.
Yeah, it's full screen. Yes. Okay. Now, who say period pain is normal? Who say that? We have heard this period pain normal since, when we are young. Who say? Our mother say, right? What's your mother say about your period when you complain to your mother when you have period pain? And she said, every mother will say, oh, that's normal, women born and then this period, I also have period pain. Many people have period pain, so period pain is normal. Being women, having period pain is normal. And who else say period pain is normal? Okay, when we grow up, when we go to school, so our teachers also say the same when we have period pain. Our teachers are the same. Oh yeah, it's period pain. Why you cannot even stand it? Everybody have period pain. You know, maybe you are just so exaggerating and people think you are lazy and then you are just too manjaing and all these things, you know. And then who else say period pain is normal? Well, when we tell our friends, you know, and we have period pain, and a friend will say, "Well, I also have period pain. Why are you cannot take all this? You know, this is just normal pain, you know." And then we go to hospital, to the clinic. So some doctors even say, "Well, you know, this is just a normal period pain." So everyone say period pain is normal. Everyone, says, so it's ingrained, it normalized period pain to the point that all of us women grown up thinking period pain is normal, right? And then when you go see doctors, so what doctor said, get married, deliver baby, your period pain will disappear, isn't it? That's what we heard. This is a common thing, right? This is all because it has been gone, right? It's just ingrained into the culture, into our thinking. Okay, what is agenda tonight? We're going to talk about the truth, learn the truth about period pain and the cause. I want to tell you about endometriosis. And I want you to also talk about the stigma you should know, and then why delayed diagnosis, why women take 6 to 10 years to have the diagnosis of period, someone to have period pain to get the diagnosis. And then, so the cause of period pain. Okay, why do we have period pain? There's two reasons. Primary period pain, in scientific we call it dysmenorrhea, or Malay say senggugut. So primary dysmenorrhea can due to menstrual cramp. Yes, this is a primary dysmenorrhea. It could be menstrual cramp, it can be normal, and it could be, this can also be physiological. But there's also pathological. We call it secondary dysmenorrhea. Mean that period pain which come later, right? Because sometimes when you start, you don't have period pain, but later suddenly you have starting having period pain. Or those period pain, when you have primary dysmenorrhea, that normal physiological pain, when you have during the teenager, you have. But as you grow up, the pain supposed to be less and less and disappear. You know, but if the pain doesn't disappear, it get worse. That cause secondary dysmenorrhea. So what are the cause of this period pain? Is a disease. One of the common cause is endometriosis, what I'm going to talk today. Adenomyosis, also that's very common. This is a two notorious cause of period pain. Fibroid, but most fibroid doesn't cause period pain, but depend on the location. Pelvic inflammatory disease, which is infection. So sexually active women, when they get infected pelvic and then they have chronic, so they do have period pain. And cervical stenosis. But most of the time in young women, all of you, young women between the age of 20 to 40, this is a common disease, endometriosis or adenomyosis. This pain, this period pain, it's just like a ghost. It's just like a devil will haunt you every month. And then they take away all your quality of life. It take away your dream. So, all right, I want you to understand first, physiological first, about menstruation. So what happened? So this is a before period and during period. So what happened? Why we have menstrual pain? So before period, you see what happened? This is uterus before period, and this is the uterus on the other side, on the left side, the uterus after period. So look at here, or during period. So before period, the lining, inside the uterus here become thicker. This is actually built by the hormones from the ovary to prepare the uterus for the pregnancy. Like as a woman after menopause, your reproductive system actually prepare itself for pregnancy every month. So it become thicker and slowly become thicker. It become like a jelly full of fluid, a nutrient, and this and that. In case fertilization happen during this time, the baby will get embedded here and can grow. But there's no fertilization happen. What happened? This wall, it will signal, it gets some signal that, to this chemically and to the brain, and then the body will produce itself something called prostaglandin. So that actually will contract, and then this thing will go down. I mean, will get what do you call this? Shed off. So it become period. So the blood vessel here get open up and all become period, All right, so that's what happened actually during period. So because of the contraction, then you feel the pain, but it's only for before period, and then immediately after period, everything will become less because this prostaglandin act very fast and for a short while. Okay, so muscle contract, it can hurt, and so this is after it shut down, it become like this. So it's a period like this. So what happened? I mean, that's why sometimes you have, so that is talking about the physiological one, okay, but not supposed to be like for 3-4 days, or it shouldn't be too severe or anything like that. So there's a symptom compared, this is a primary dysmenorrhea, which is like a common period pain that we have, and this secondary dysmenorrhea is a pathological. So onset is only first day before period. This is talking about those normal one, and duration is only about, is less than, the most is 2 days, and then lower abdomen, and then with age it gets better. But if it's a disease one, okay, this is something you need to identify. Not all period pain is normal. So you have the pain 1 or 2 days before period, and then it can last more than 3 days, sometimes throughout the period. After period also, sometimes you can feel the pain, but the worst is during the period. And then after that, it get worse as you grow older because the disease become more severe. In fact, you can also identify the pain score. Normal period, normal. I'm talking about physiological normal period. Usually, you shouldn't get pain more than 3/10. But if you have, if you have to score 0 to 10, if your pain score is across 5, then you have to find that maybe you're having some pathological period pain. It could be a disease. So this is how you can rate. So if you have any of your friend come to you, okay, I'm having severe period pain, you ask your friend, 0 to 10, give me the score. If she say my pain now is 7, so she may have a pathological period pain. So it could be a disease that she need to go and see a doctor. All right, okay, now endometriosis, just giving that the background, okay, at least you know when is a period pain normal, when it's not normal. Okay, now we're talking about the most common cause of period secondary dysmenorrhea is endometriosis, affecting young women 10% in the population, almost across the world. All right, so this is a very enigmatic disease, emotional disease. The disease, is very hormonally dependent, causing chronic inflammation, multifocal. Is a whole thing. It's a disease. And what happened to this disease? Actually, the main symptom is period pain, pelvic pain, sexual pain, and then sometimes passing motion pain during period. And of course, 40 to 50% of them actually have infertility. It causes infertility. All right, so look at the global, the burden of this endometriosis. All right, just now someone mentioned 2 to 10% of women of reproductive age. Reproductive age means young women. Women at their best time in their life. I mean, as prime age, where you want to achieve your dream, you want to become mother, you want to enhance your career. This is the time you're affected by the disease and the whole reproductive age. And then 30 to 50% of women, infertile women, have endometriosis. It destroys the pelvic organ. It destroys their future fertility potential. And then 5 to 21% have a severe pelvic pain affecting their quality of life. They have to manage the pain, and then they were just being haunted by this pain. The pain will never leave them, and they keep coming. Every month visiting them. And all right, 350,000 of women in Malaysia are affected by the disease. All right, the symptom I already mentioned to you: pain and suffering, debilitating chronic pelvic pain, sexual pain, urination pain, abnormal menstruation is affect the ovaries, and then sometimes they have gastrointestinal upset like diarrhea, constipation, bloated sensation, dyspepsia, and they have all the symptom. The risk factor who get endometriosis. Okay, there are some risk factors. Okay, not every woman has endometriosis. We already said just now about 10%. Some places even up to 20%. But there are some women, that get endometriosis. So who are these at risk? Those with the family history. So you ask your family, your cousin, your auntie, if they have endometriosis, you may have chances to have endometriosis as well. Those who have period too early, less than 12 years, mean that you're exposed to the period too early. So that also have a risk of endometriosis. Those who have cycle are too short, like every month, early the month, and end of month, less than 21 days. So the period happening too often, they also have a risk of endometriosis. Or those who have heavy period, young teenagers who have a very heavy period, so these are also have a risk of endometriosis. And those, of course, women with infertility, and then who are too thin also has risk of endometriosis. Okay, now the onset. When this disease started? Okay, the onset of the disease, surprisingly, it started right after the women menarche. That is the onset, the disease begin, because when they have period, what happened? For those women at risk who have some have genetic predisposing, so the period not only goes down into the vagina, but it also spill over to the back, follow the tube. So what happens is that when they spill over to the back in the abdomen, they carry some stem cell from the inside uterus. And then when they actually stick on the outside of the uterus, sometimes on the ovaries, sometimes it's on the tube, sometimes it's on the bowel, they can be on the bladder, they can be at the floor of the pelvis. So what happened? This cell respond to hormones just similarly like the uterus just now. Remember, it gets shedding, it get respond to the hormones, become thicker. Same thing happen outside the uterus. That's why endometriosis definition is endometrium-like tissue, which is the tissue inside the uterus, found outside the uterus and act as if that is a reservoir of menstruation. So when they bleed every month there, that's why they're having painful every month, because it's bleeding there at the back. And what happened with the bleeding? There will be inflammation. The body was trying to clear the inflammation. And then what happened? And it's keep in repeating the injury. I mean, when you have chronic inflammation, there will be fluid, inflammatory fluid. There will be all the mediators and this and that. They stick the organ. They bring the power, the tube, the ovaries together become one big organ, just sticking like a uh, glue to each other. So that's why it's painful. Sometimes there's a nerve entrapment and it destroys sometimes the organ. It can infiltrate into the bowel, it can infiltrate into the ureter, to the bladder, and so on. So this is why this disease is very notorious. And right, so it started right there, and the onset is there, and they're having period pain, just getting worse every month, getting worse. And then eventually when they become because most of the time the women will normalize the pain, right? When they are young, normalize, oh, this period pain, even how severe, so, or maybe I'm just exaggerating. And then okay, everyone say normal, also I also assume normal, so they end up until in the 20s only they come and see the doctor. By the time, or maybe when they get married, they want to get baby and they find that they cannot get, then only they see doctor. Or when they have big ovarian cysts, blood collection, then only they come see doctor. It's when diagnoses were made. But actually the onset is like 10 years earlier. If we can actually arrest that, long time ago, perhaps we can save these women reproductive. All right, so what is the stigma? Why that the myth and stigma? The stigma is people say period pain is normal, as I mentioned to you. And people say, oh, this is a hormonal problem. It will disappear when you get married after childbirth. And some people say, since you have experienced childbirth, this pain is nothing compared to that. I mean, this is what people say. This is a patient of mine saying. This is exactly the word I'm just taking. And some people say period pain and childbirth pain are God's way of cleansing sin. So see it positively. I mean, can you imagine that someone say like that to you? When you have severe period pain, they say, oh yeah, well, you just have to bear it, because why is good cleansing your sin, and you can go to heaven next time because it's good. At least you got just period pain. You're not going to hell. I mean, some people even say such thing, don't be too weak. Every woman here has period pain. I mean, this is women telling women. All right, so don't be so weak lah. Why you like that? Every woman here also have got period pain, but they didn't even say anything, I mean, people say like that, right? So this I think, I mean, we thought women would be understanding, but sometimes you have these women saying things like that because they think their pain is the same like yours. So people don't see that you have a problem. They don't have a problem. Okay. So stigma. So this effect of normalization. I say everyone want to feel normal. I mean, and because of this gender thing, people relate period pain and women. Women are weak. So when they have period pain, pain small, that pain must be not too bad, but it's just because they are women, and then they think that this period is very bad. But if men have pain, can you imagine that? if man has period pain, have pain, you know what do the people do? The whole world will come attend to him because why? Wow, this man is such a strong guy, and you know, if they have period pain, must be real pain. You know, people think like that. But it's women pain. Yeah, this is small pain. I mean, they just want to manja. This is how it is. You know, so that's why sometimes this we have to live with that stigma. So 80% of women, 16 to 30, would put off going to a doctor with symptom of endometriosis because they don't think it is serious enough. They don't think they would be taken seriously or think symptom painful period are normal. So this is a thing we have been brainwashed. 50% of women aged 16 to 40 would be reluctant to tell their employer they needed to take time off due to endometriosis, due to pain. We have to manage ourselves quietly and this and that, and at the same time we have to do some work, do our work, and we don't people don't know, like people we don't know as if we are very weak, but we're having serious pain here. I mean that, but only you know the pain, nobody knows. And everyone don't believe you because you keep on complaining. So this, I think people don't have the sympathy because of people don't understand that there's because of this effect of normalization, they invalidate, minimize, trivialize, your experience. All right. Okay. I want to give you the real scenario. Okay. This is what when people normalize the pain. This is what they see. The real devil that actually causing this pain. This patient, case number 1, 32 years old Malay. This is a real thing. Okay. All right. Bank officer. Look at that. Painful menses. Pain score 910. Okay. Left-sided pain score 610. Painful during bowel opening, 810. Painful intercourse, 710. Okay. Had operation before, one time, remove ovarian cyst. All right. And diagnosis of endometriosis at the age of 26. Had period pain since the age of 18. Okay, look here. Diagnosed endometriosis at the age of 26, but has been having period pain since the age of 18. And look at here, this woman have what? Look at that. Look at this. This is the ovary. And look at how sticking this ovary to the wall. I cannot even lift up, and then look at this tube, it's so damaged. And then you cannot, usually you should be able to move it up. It's very mobile. And look at this bowel actually sticking to it. And so this is the endometriosis. Look at that. Look at this is the, up here in the middle is the uterus. Look at that. So stick. And then there's a nerve below there. Actually get entrapment. You see, I cannot even lift up, this ovaries. And with the cyst and inside there with the chocolate. So you can see a chocolate. So because it caused by this endometriosis. Okay, look at that. It's a chocolate cyst. See, this is all chocolate cyst below that. So this is the pain this woman suffering for many years, and everyone say that her period is normal. All right, so case number 2. Okay, 26 years old. Not the age of these people. Young women. Product specialist. These people are very well to do. I mean, they are career women. Okay, painful period, 9/10. Painful bowel opening, 5/10. Heavy menstruation. She's on multiple painkiller. Okay, has period pain since 16 years old. Have been many clinic, but no diagnosis given. She was told to have hormonal problem. So that's why she come and see me. And then this is what. Look at that. Her ovary, ovarian cyst, chocolate cyst. Look at it, sticking to the wall. I say, I'm trying to separate it, see, look at that. And this is the bowel in the between. Okay, and it's got a chocolate cyst coming from that ovary. All right. And then, all these are cysts and the bowel in between there. And these are the disease that actually we normalize. And these are the pain these women have been suffering for many, many years. And if you look at it, destroy her pelvis, this patient. All right. Right, so this is one example. Number 3, young women, 36 years old, again, young women, doctor, single, pain, score 1010, painful bowel opening, 910, pelvic pain, backache, 710. She got bilateral ovarian cyst. See, look at that huge cyst left and right. You see, this lady is single. I cannot even find where is the uterus of this woman. Look at everything are sticking to each other. Bowel, the ovaries, the cyst are sticking. I'm cutting the bowel now. Try to separate the bowel from adhesions. Sticking. I cannot find where is the uterus for this patient. She has been having period pain since teenager, painkiller most of the time, unable to focus on her work. And then she finally get operated last 1 year. And then 1 year later, she got another recurrence of symptoms. So look at this, her uterus is down there. everything are buried under the adhesions. We call it frozen pelvis. And this is a doctor, so look at that. See, look at that. I have to hang the uterus up, and then in order to separate, this cyst from the uterus. So this is the thing that case number 4, same, 32 years old, content writer, singer. All right, dysmenorrhea, period pain, 910, chronic pelvic pain, 710, this case here, which is a pain passing motion, 910, okay? Again, period pain in the age of 18, have a multiple painkiller, hormonal contraception, progestogen, whatever she's on, the pain was not relieved, okay, has seen by many doctors in private clinic and government clinic. Diagnosis, chronic pelvic pain. No diagnosis, just say chronic pelvic pain. That's all. Look at that. She comes to me, we operate her. And the whole bowel down here is so sticking, I cannot even separate it. And then not only that, on the other side, she has a ureter actually obstructed. Look at that. So she has all these cysts, and this disease has infiltrated into her ureter, causing hydronephrosis. One of the kidney almost damaged. See, large ureter, because the urine cannot go into the bladder there, because it get obstructed at the end of the tunnel there. So this patient, so she's having almost damaged one kidney. All right, so another one, last patient, Chinese, years 25, 29, 28 years old, married for 5 years, period pain 910, sexual pain 610. This case here, period pain, past motion, past urine also 710, infertility, trying to conceive, 2 previous operation, and then got ovarian endometriosis, the repeated operation, okay? And then again, onset of period pain since 16 years old. Pain recur 1 year after surgery, treated by hormone, everything, okay? And you see, then she got, what does she have? She has everything. She got bladder endometriosis. Look at this. This is a uterus, and then this is a bladder in front here, already sticking to the uterus, and there's endometriosis, actually has gone into the bladder. And then at the back, the endometriosis has gone into the bowel. So front, back, everything actually are affected. The operation take already very long time to correct her pelvis. So what's the learning point here? All are young women, nobody at 70 years old here. Nobody, they're all starting their life. They're all just about to live their life. Living, okay? Start to get a job, want to get married, want to have children. Onset, most of them all early in adolescence, the disease. Common symptom, period pain, sexual pain, pain during passing motion, okay? Seen by many doctors previously. Pain score all above 710, and they have a multiple pain relief, and they have had multiple surgery for endometriosis, and disease manifested in spectrum, that so many things. They got ovarian endometriosis, they also got bowel, got bladder, and then complicated by fibrosis. All are sticking into each other. So this is a look at all the learning point. You can see just now all those 5 cases, right? All right. Okay. Now do you understand about endometriosis? After this, I hope you don't say period pain is normal. All right. Okay. So I want to just let you know period pain. Okay. The endometriosis have many types. We call it spectrum. Okay. It's not just one disease. They come with different type or different severity. Okay. One is superficial endometriosis, and then those on the ovary, we call it endometrioma or chocolate cyst. And those deep into the bowel, into the bladder, we call it deeply infiltrating endometriosis. Or on the uterus, we call it adenomyosis. Okay. So, and then this is a superficial look like this. It's a beginning look like this, just a sticking, a small spot only in the pelvis. All right, so some people, they have period pain. Last time they did a laparoscope, tengok, oh, nothing much, and then they close. But actually, this is the one who causing the severe pain, even though they are small, but they actually can multiply. And then if they don't cut it off, they can actually cause even more serious disease. So this is sometimes young teenagers have this, but they don't not diagnose. So that's why they end up with the cases that you saw just now. All right, endometrioma is those affect the ovaries. So when they affect the ovaries, and the blood collected inside the ovary here, every period there will another blood collected, and then they become bigger and bigger, and then they cause sticking to each other and so on. Okay, so that cause can cause infertility, and also what they call this, they can also go into malignant transformation, can become a cancer as well. Deeply infiltrating, this is the most notorious one. Just now you saw, most of them has, they actually infiltrated, at the back of this, the front of the uterus. They goes to the bowel, they goes to the bladder, they goes to the ureter, causing damage to the kidney, causing damage to the bladder, and also causing obstruction. And then it can affect in even young women as well, right? At the beginning, also sometimes those severe one can also have deeply infiltrating endometriosis. Sometimes those women are present with all the three. See, superficial also got, ovarian endometriosis got, all the three is in one go, So, so that's why sometimes the disease can be very, very serious. So that's why they got a stage. It's just like cancer. Cancer, I mean, some patient of mine say, "Oh, doctor, I prefer to get a cancer than having endometriosis because nobody pity me with endometriosis, but cancer, because you're going to die, people give you importance, right? So, but the thing is that, yes, cancer kill, but endometriosis torture you the whole lifetime. It torture you when you're alive, living, right? So which one is better? So sometimes some patients say, doctor, I feel like I better die. I want to die before I having period. People feel better dead to be living in agony. Some patients even think like that. Okay, how do we diagnose endometriosis? Okay, we can do many ways to diagnose. Okay, clinically, using, usually we diagnose it clinically by patient symptom, asking, and then we can do ultrasound. The doctors now have more awareness. So we do ultrasound, and just by patient symptom, we can make a diagnosis. We can diagnose patients straight away. No need to do serum 125. But of course, sometimes we already diagnosed, we want to assess further when we do MRI. And then, in fact, if we cannot even find anything, but patient still having a lot of pain, and then we give medication first, but it doesn't work, then we do laparoscopy. All right. So diagnosis, I mentioned to you the onset of endometriosis in adolescent. It started young. Okay, people delay diagnosis up to 6 to 7 years before they can get diagnosis. Some people even see doctor. Average 9 doctors still no diagnosis. But however, having said that, 11% of patients sometimes have a severe disease but completely asymptomatic. I mean, this is what endometriosis is. Just so funny. Some people got small disease, but they have maximum pain. Some people have a maximum disease, but very minimal pain. I mean, so these are the funny thing about this disease, okay? Misdiagnosed. And also they're very common. Some women has the bowel symptom more than the period pain. So they get diagnosis of bowel irritable syndrome, urinary tract infection. And then people forget. People don't want to think that period pain is normal. They don't want to investigate. The moment you say you got bowel symptom, people start looking to, okay, let's do colonoscopy, let's do this, do that, or they think of more of a gastrointestinal problem or the bowel problem instead of endometriosis. It's very common, okay? So do that. All right, so that's the thing. All right, so I just mentioned to you the why that delayed diagnosis, because again, frequently misdiagnosed, right? People diagnose you something else. All right, then all this bowel related, bladder related instead of endometriosis, and so that's why. And see, that's why women has this kind of long story when it's a journey, and of this period pain, and again, go to school, and it is a whole way, and and trying to get pregnant, and then after that, unable to conceive, to see the fertility specialist, and then get laparoscopy, and this is the whole journey that women go through. Because it's a whole life disease. This is during young, when you have teenager period pain, on pain, on Panadol, on Fonstan, hot water or something, and then missing from school, and after that get married, and then want to get pregnant, and then see doctor, cannot get pregnant, see doctor, and then after that on so many medication, on so many operation, repeat operation, end up has to do hysterectomy, and that's it. And then so this is the whole lifetime. All right. So workplace also can be a hardship if no people don't understand this disease. Okay, so that's very important actually to bring the awareness of endometriosis, support women at the workplace, because most of the time women, most of the women, they are able women, they are very clever, they actually potential to grow into their career, but just that because they're having the disease, sometimes, they are so scared to even tell their boss, and thinking that the boss might not go to promote them, and thinking that, they have to hide, they have to suffer all by themselves. Okay, so nearly 60% reported inability to manage work schedule, more than 50% not able to have work hour flexibility, 48% feeling judgment or stigma, over 1/3 fear job loss and firing due to their endometriosis, and 40% indicated they perceive their employer to be unknowledgeable of the impact of the workplace environment on the management of. This is a study, actually, this is a result of the study that people have done, with regards to women who complain of period pain or who manage their period pain, at workplace. Okay. All right. What is the treatment? Endometriosis. Okay. How do we manage this endometriosis? Okay. To get diagnosed is so difficult. And then how do we manage? Okay. So, right. So, okay. The treatment. Okay. There's no permanent cure of endometriosis. Okay. Unfortunately, because the disease, you remember I told you just now, retrograde menstruation, backflow. All right. Okay. And then this is how the disease started. So of course, after you get disease treated, when you have period, it will still backflow again, and repeated that, and then you can get another round of endometriosis. So this is the problem. All right. So, but I think the early diagnosis is very crucial, because why? We want to control the symptoms so that you can have quality of life, and then so that you can treat your infertility, or we can prevent you from having infertility if we treat you early, and then we can reduce the risk of it recurrent, because we can control your period, and then so that you don't have reduced rate of repeated surgery. If not, you end up repeated surgery so many times during your lifetime, especially during you're young. And I can imagine that you have to keep going to hospital and operate so many times, and then how to grow into the career, right? All right. So hormonal treatment is the first line, and usually young people, the first thing we want to do is treat them with hormone. We want to control the period so that period won't be too heavy, won't be too painful, and you can learn your life so that you can live your life. I mean, young people, please go and jump, climb mountain, please, and then go jumping here and there, and then live your life and be happy. And so this is what, we want young people. So we treat them with hormonal treatment, and so that the disease is under suppression, and with that also they won't get all right, so the aim of medical management just now, suppress ovarian activity, and then minimize the repeated surgery, and also maintain symptom-free for a long period of time. There's so many medical therapy in the market, We can give OC, we can give progestogen, we get IUCD, we can give so many things, depend on what's suitable for the patient, okay? So the whole idea is to treat menstruation so that they don't get, less period, so less backflow, and also they don't get, we can regulate the period, we treat vaginal infection, and then we can delay menarche. Even some people, we can don't want period so early, we can give them some medication so that they period maybe at the age of 15 or something, then they can manage better, and then diet, very important, high fiber, high antioxidant, probiotic, because, there's something to do with that abnormal bacteria in the bowel that also can cause endometriosis, okay? So important early diagnosis, early starting the treatment, then we can control the disease. To operate, not to operate. Okay, when to operate? Yeah, surgery is not only effective, but also, it is a definitive. Medical treatment is only what? It's to control symptoms and, control symptoms. You cannot cure the disease, but it can control the symptoms, suppress the symptom. But the moment you stop the medication, the disease, the symptom might come back, okay? So it's very important, all this, whether to operate, not to operate, it depends on patient age, the severity of the pain, duration of infertility, readiness to get pregnant, whether the disease is one ovary or both ovary involved, or whether patient have previous surgery or not, or whether they have a coexisting. So these are reasons why we want to operate the patient, because some patient, 20% of patients require surgery. All right, so why we do surgery? Because to improve quality of life, can improve longer pain-free, less recurrent. We try to avoid recurrent, and also fertility, improve their fertility, So the aim of surgery, if you want to do surgery of the patient, remember, if you have any of your friends, if they need surgery, the first surgery is very important. It should be the last surgery. So when you do that, it means that you have to go to the best doctor to do this surgery, so that risk of recurrent is low, so that we can clear the disease at the first time, not like after 3-4 surgery when they come to see us, very difficult to to resect the disease because of the additions. So the first surgery, if we want to do the best surgery and should be the last surgery for the patient. Okay, complete excision of the disease, and after that we give them a long-term treatment. Okay, so that's very important. So surgical expertise is very important. Not all gynecologists are trained in advanced minimally invasive surgery. You cannot do open surgery for endometriosis. It has to be minimally invasive, robotic or laparoscopically. Okay, so the best surgical outcome require experienced endometriosis specialists and a multidisciplinary team because it involve the bowel. Look at that, involve the bowel onto the uterus. This is robotic. Okay, so it's a very precise surgery. So, and then we can actually do the operation better. We can clear the disease better, provided they come early. First surgery is the best surgery. Remember, if any of your friends have endometriosis, they need surgery. First surgery is the best and supposed to be the last. You must make sure that you see the best doctor to do that surgery. All right. Okay, take home message. Endometriosis is more than just ectopic, but it's a systematic inflammatory disorder involving multi-system, bowel, bladder, everywhere. The onset of the disease is early in adolescence and manifested later in early adulthood. Delayed diagnosis causes misdiagnosis and normalization of period pain symptom. Primary prevention of severe disease early may offer reproduction. We can actually protect the patient's reproductive potential and also quality of life. Medical treatment is the first line for those who not seeking pregnancy. Surgical intervention is indicated when medical and infertility treatment has failed or when function is compromised. First surgery offers the best outcome and should be the last. Complete excision of the endometriosis lesion is crucial to reduce risk of multiple surgery in young women. Endometriosis surgery is best done by a trained endometriosis surgeon with a multidisciplinary support. Okay, thank you. This is my book. Okay, please go and look for this book, Fighting the Devil Within. I wrote this book. Many patient experience actually have written in this book. And then I put that this is the devil. Memang it's a devil, okay? It's a devil that actually haunt that women every month, take away their dreams, and then, take away their quality of life. And, and only they know. Nobody believe them. Can you imagine that? Only they see this devil. I see this devil because I operate this woman and the devil is living inside them, and then so most of the women live in the disbelief that what do you call this that nobody believe them. So please come and go and get this book. All right, thank you very much for your attention. Okay.
Thank you so much, Dr. Sharifah, for such a clear and eye-opening talk. Doctor, can I check if you have a little bit of time for Q&A? Maybe 3 questions.
I think 1 question because I have to attend another meeting. Yeah, sure.
Okay. Anyone have questions? Else, I will ask. Okay, in your experience working with women, what is one thing that you wish more women knew that and believe their own body, especially when you share with us that the pain or symptom they have been taught that to ignore?
Yeah, I want women to believe their pain. All right, and we as a woman also must believe. And another woman say they're having pain, please believe them. Their pain and your pain is different. All right, and then everybody has a different experience also. So we need to change this narration. Okay, that period pain is normal. So we must say period pain is not always normal. Okay, so we must change that. We want to tell our children. If you have children, when your daughter come and tell you, please don't tell them period pain is normal. And then same thing in the teacher, we want to change the teacher mindset. Okay, and that all period pain has to be investigated first. All right, and before we can say period pain is normal. So we want to change this narrative. Okay, so those women out there, if you're having period pain, and then your period pain is unusual, pain is for a score more than 5, please check first. Okay, don't assume and your period pain is normal. Okay, what you feel is true. I mean, you only know, that something wrong with you. Okay, so go and check. It's very important. Yeah.
Okay, thank you, Dr. Sharifah. We are really honored to have you, and thank you for your insightful and empowering session today and your time and effort. Shall we open our camera to take a photo with doctor? Everyone? And SAA, can you help to take the picture? Okay.
Okay.
All right.
So everyone ready with the camera. Okay. Okay. 1, 2, 3.
Okay.
Okay.
All right. Thank you for
Okay,
having
thank
me.
you, Dr.
Just
Yes,
Sharifah.
and
one second. Another page, please. We have two.
Okay.
Okay.
I took two. Right now, I took two.
You took, okay. Thank you.
Okay. Thank you so much, Dr. Sharifah.
thank you.
Thank you,
All right.
Thank
doctor.
you.
Okay. Good night, everyone. Yeah.
Bye.
Thank you so
Bye-bye.
much. Truly appreciate it. Thank you. Thank you.
Thank you, Dr. Sharifah.
Well, thank you, everyone. And it is really, really insightful. And I was shocked about just a common pain and normal pain. Then it caused a lot of things that. So please don't tell a friends or daughter or any woman that, yeah, very normal, like the pain. Every woman will have the pain. So I hope you enjoy the sessions and then take anything that is a highlight or any knowledge back home. Okay, thank you, everyone. I should pass back the floor back to the TOE, the Toastmaster of the day. Thank you.
Thank you, Anisha. Now, let's proceed with the evaluation session. Over to you, Yvonne.
Okay, thanks, Hui Yin. I was so engrossed into Dr. Sharifah sharing, but luckily I have my draft ready. So thank you so much, Wendy, for sharing with us your speech about autism, especially in female. Although not narrated in the topic, but eventually you have explained it very well in your speech. So what I like about your sharing is you have intrigued a very interesting topic, and it's good to create more awareness about autism, especially among the females. And we now understand more that although all autism, females behave differently among level 1, level 2, and level 3 compared to the male counterparts. That is a very great sharing, and you have successfully split the entire storytelling into 3 levels according to the level of seriousness in the autisms. So what can be improved in your speech is, because your speech is highly technical and include a lot of jargons, I would say, it's very hard for people to, on the first glance, to understand the content. So you can include more vocal varieties and also perhaps even body gesture to let people understand which part that you are getting on, whether it's level 1, level 2, and level 3. And you have included an example in the level 1. For example, the level 1 is having some non-verbal by having eyesight, giving compliments, but actually glancing people from the top and then until to the down. And oftentimes it will be misunderstood. However, these examples are not very clearly illustrated in the level 2 and also level 3. So I will highly encourage you to include more vivid examples and storytelling so that the general audience like us, who have never known what is autism, especially in females, is all about, we will be able to identify what are the behavioral difference between a normal people and an autism people, and autism female and also male. So include more examples in the level 2 and level 3. So in long run, I think you are very gifted in speech. Is to challenge you, perhaps you may also include some interesting slides that will help you to, it can guide you all around your 7-minute speech. And at the same time, it will create more audience awareness in terms of this technical speaking and able to share what are the differences between the normal people and also the autistic people. And thank you so much. And I hope to look forward to your next speech. Wendy, back to you. TOE.
Thank you, Yvonne, for your feedback. Next, I would like to invite Crystal Chin for table topic evaluation session. Over to you, Crystal.
Thank you, Huyin. Like I say, definitely, I would say a very interesting and one of a kind table topics that we have by our very seasoned June. A before and an after. How do you connect the before and the after into one story? How do you gel it? I was clearly waiting for it. June, I appreciate the fact that you took the time to explain to the guests what is table topics and the rules of it. So going into Betty, our seasoned Toastmasters, is clearly shown in your table topics where, you know, I was so engrossed, I actually forgotten I'm supposed to evaluate the table topics. So you have clearly what we call, I need to preempt you. How did you get, you know, your financial freedom, your career, your spiritual that you mentioned? You know, I'm clearly entranced by your table topics. It makes me, oh, can she talk more? Yeah, 2 minutes. Well, got enough. We might have even a whole session for you after this. I think one more point in, as usual, we say in Venus, that we hope you could elevate it further, Betty, is a bit of hand gestures, because we see you are very well positioned in the center of your screen, but maybe you can use a bit more, you know, and that will make it even more perfect. So moving on to Sarah. Sarah, I love your tone. I love the way you speak. You know, it's so elegant, it's so poised. But as you mentioned earlier, you know, as you were boiling the cup of coffee, we're all waiting to be continued. Unfortunately, it didn't happen. So we'll hold it to you. Next round, you come to Venus. We're waiting for your part 2. So one point to improve, I believe, Sarah, you're holding your phone. So it was a bit shaky. If you could, it would help if you just put it down, you know, or position it against a mug or something, you know, then it'll be more better rather than having holding it, your phone, while speaking. Nonetheless, I'm still waiting for part 2. Going into Shamin. Shamin, your story from how you become a Grab driver into, you know, being the best 5 rated, it really put my whole imagination to test, right? I can imagine you driving and all. So you're definitely a wonderful storyteller. My only one wish is I could see your beautiful face while you're actually speaking. So that would add a bit of context to it. I'm more engrossed, but nevertheless, you know how the podcast and all, it's so famous right now. You're definitely sounds like a very good podcaster storyteller. So over back to you, Huyin. I hope it helps in terms of my evaluation for all of you.
Thank you, Crystal, for your evaluation. SAA Wendy, may I know, do we have the voting session for table topic?
Yes,
Speaker?
I can launch it now.
Wonder whether it's all on the time frame, Huyen?
Okay. Has everyone done your voting?
Currently, we have 14 people voted.
Yeah, I think it's good now, so we can end with 3, 2, 1.
Okay.
Thank you.
Thank you. Up next, we will have the timer report from Michelle Ma. Over to you.
Can I share my screen? Can you see the report?
Yeah.
Yes.
Yes,
Yeah.
Michelle.
Okay. So basically, we have Wendy as the prepared speech, and her speech requirement is 7. Requirement is 7 in terms of time, and she's only slightly above, which is 0.4, and she's still within the time, which is yes. And for the table topics, I have Betty, which is 2 minutes and 35 seconds, and she's not within the time. But for Sarah and Charmaine, 1:41 and 2:06, and they're both within the time. And for Even, it's for the evaluation done by Even is 2 minutes and 31 seconds, and she's within the time. And Crystal as well, 3 minutes and 23 seconds, and it's within the time. Over back to you, Huyin, on this.
Thank you, Michelle Ma. Let's invite our R counter, Eva Chin, for the R counter report. Over to you.
Hi, everyone. Let me share the screen. Everyone, if you look at the reports today, well done, everyone. I would like to give a clap to everyone because if you look at the filler words that you all have been using, is nothing much, especially give a good TOE. Yeah, you did a great job. I didn't catch any. Well done. And for Wendy, for Wendy, I only have 1. It is so hard to catch her as well because she did so good. For table topic June, I noticed that she did use a bit of a bit of and a bit of so. This is actually unavoidable. I can totally understand because everyone have this. And Betty, your story is very touching and I only capture so. Sarah, you dropped the line, so I capture only 1. And for Shamin, she's very vocal, very happy. They have a bit of ers, so repeats and okay. Even myself will have that too. So it's normal. We just need to reduce that. Even don't have, as usual, even 0. For Crystal, I noticed she have and also VVV and ayah. And then the timer 0. That's all that I can hear from today. Thank you. Or back to you, TOE, Madam TOE. Thank you.
Thank you, Eva Chin. Let's move on to the awards and recognition session. Can I hand over to President Crystal?
Sure, thanks, Huyin. Can Wendy, are we good to have the appreciation? Oh, okay, we put it on. Okay. So congrats to Charmaine on being the best table topics. Can we spotlight Charmaine? Charmaine, are you still here? Is Charmaine still here?
I can't see her. Sorry.
I think she's dropped off, so we can reach out to her after this. Okay. Can we go to the next? Okay, I think we can send Dr. Sharifah and a personal thank you note after this. Okay. All right. So thank you very much, everyone. I think we're ahead of time. I would just like to, is there anyone who wants to share a little bit what you have learned? You know, how does this benefit you? Maybe we go a bit to the guest. Ani, Cikgu Ani, you have anything to, you know, I hope it benefits you. Maybe anything to share from your side or any, you know, airtime for you?
Thank you for sharing the link and let us attend to this insightful meeting. I think it really benefits everyone. and we really need everybody here need to pass the message across so we have that we can help others and fight this disease. Thank you. Great meeting. Thank you very much.
Nice having you here. How about I'm just going through my screen right now. If I just call you out. How about for Elva? Anything to share or any airtime?
No airtime. But anyway, thanks so much, Crystal, for this invitation. So I guess the special topic on covering this endometriosis has been helpful. So aside from the usual Toastmaster meeting, I do think that this is something that very informative, that you can add value to the guests. And of course, as usual, Venus Toastmaster Club has been a very well-organized meeting. So I hope there will be, future chance that you can get me to join again. Yeah.
Sure, we always welcome you.
Thank you.
Nice. Thanks, Elva. Okay, anything from Jenny, Anna, Cynthia, or Sarah? Jaga, our
Yeah. I go
okay,
first
go ahead,
or
Jenny.
Jaafar? Okay, sure. Thanks, Crystal, for inviting me to this talk, because I actually wanted to join few of the talks that Venus had hosted previously, but I think due to the timing that I couldn't make it. And thanks for Crystal the invitation. So I really like that you guys having the topic is always empowering the women. So I hope to join your meeting in future. Thank you.
I think for all, we always welcome anyone who wants to join us, especially if we have any special events. The door is always open to all. Betty, thank you for your words of compliments in the chat.
Yes, I also must thank you. Actually, I had forwarded the same WhatsApp info, which is so useful to my own Metro members. And so strange, I didn't even see any response. But immediately I think of my good friend, Jackatis, who has quickly joined. I said, never mind, from the itinerary, they have just started. I also joined late. At least when you send me that invitation specially, I quickly got my stuff to get out of the office. I need to lock the office quickly. I got to run back to the house. And when I managed to off screen, managed to gobble down my food for my dinner just now. That shows how much of effort. I quickly shower briefly and I didn't miss anything. I am truly amazed. Even for June, I must give you a shout out to you. Very innovative way of your table topic question. I really love it. You really put me really at the fix, because you call me out. Suddenly I say, huh? Before and after, I got to combine and tell a story. I got to fix it up quickly. Luckily, I did not freeze totally. I salute you for your innovative question way.
Thank you, Patty.
Yeah.
Thank you for being so sporting.
And I really love your standard has been very high. From the few times that I joined in, Grand Marian, you also have got very good capturing. The only thing for today, I roughly went through your WhatsApp when you shared, you missed out on the word of the day. So I was also trying to find out what is the word of the day. Maybe this is a little input to share with you. Okay, thank you.
Thank you, Betty. We'll definitely put in word of the day. All right, like say, I'm opening the floor. Anything you would love to share, even for our winners members as well.
Maybe we want to hear from Jack.
I posed the questions, Crystal, in the group, in the chat. I wanted to know that the YouTube video will be done by tomorrow, because I want to post on the LinkedIn so that can create more awareness about this topic, and also telling more people to comes to visit our Venus Toastmaster in the future.
Sure. we'll try to get it out as soon to everyone as soon as possible. Okay, Eva? I'll be PPR. Yay!
Yes, ladies, my name is Jack here, and I'm a good
Okay.
friend of Betty. Anyways, today's session was really interesting, and I wish to get the recorded copy so that we can share with the rest. We have many ladies and also children who are suffering from this period pain, right? I've got my eldest daughter and the second daughter also. My second daughter is facing the same problem. So I was telling her, she came in just now from work. I told her there's a subject going on about period pain. She said, okay, mommy, just let me know whatever information you can gather. So therefore, I wanted to see Dr. Sharifah once my daughter is free, maybe we'll go to Picaso Hospital to look into it. Otherwise, today's session was very interesting. And Betty, thank you very much. Yeah, that's all from me.
We must thank Venus, not me.
Yeah, Venus Toastmaster Club. Okay. Yeah, thank you very much for the Venus.
Right. Like I say, thanks so much, Yaga, for your input.
Mhm.
Okay, I think I will just conclude here for everyone. You can stay on because usually we'll just run through this until 10. So to conclude, I would say that, we hope that you have a good time. That's one, but also with a knowledgeable time. As Dr. Sharifah mentioned, period pain, a little bit of discomfort is fine. But if you're having severe pain, the first step, the best, as they say, the best prevention is better than cure. So we would like, to pass the mantle or the baton to everyone here. So if you hear people, or ladies, you have your sisters, your mothers, your kids, your friends, your besties, people that you love. If they are mentioning, they're having severe pain, they are sleeping on the couch, which I know, which I'm going to share after this with my friends as well. Every time they have their pain, they're immobilized for the whole day, 2 days, 3 days. Now we know it's not normal. So, we don't normalize something or stigmatize something that is, it's painful. It's like a living torture every month. But, this can be solved. So spread out the word. The purpose of this meeting is to create more awareness that we can lead a more fulfilling life, a better quality of life in that context. So spread out the word. When we have the YouTube, we'll definitely share with all of you. But I truly appreciate your presence in Venus today. So we hope that whatever knowledge you can do share around so that it will help somebody in that context. I think it all boils back to our vision, empowering women. So by that, we improve even one person's quality of life, or we have a prevention early. I believe we have very rare juniors here as well. Erin, our most junior one, even Esther. If you hear your friends, this one having very bad period pain, you might ask them, say, hey, maybe you tell your mommy, just check it out more, look out. It's always better when you're younger. You can prevent a lot of things. And with that, I would love to end our Venus Toastmasters Club meeting for today. Thank you very much for joining us. If you want to stay back, please do.
Crystal, can I take
Yes.
still just 1 minute to share my thoughts? I must
Sure.
applaud you and have taken the trouble, not just sharing something relating to communication. Each time in all the club, we are talking about communication pathway and all these things. But what is so special, I really feel I must applaud you because of your engagement of specialists like relating to health, because this is so relevant to all of us, like you say, empowering women. This is so relevant for our day-to-day life. If not because of this insightful session, we never know that there's so much of the agony which we just push aside. But today we are really gaining a lot and a lot. It was tremendous. I am incredibly honored to be present. So thank you so much once again to all of you in Venus.
Yeah.
Keep
So
up
can
the
I
good job.
say something that we need to also give a shout out to Enlisha, because she led the
Yes.
sessions smoothly and fantastic, and the way the presentation was done was excellent. Thank you, Enlisha.
I think the person that we have to thank most is Alicia, because she's been liaising for the past few months with the hospital, with the doctor, to get this, up in place, whereby, we can pass the message along. So kudos to Alicia. And of course, the EXCO team. Previous term, like we always say, cannot size out first, don't wash hand first in that context. Because we're interim, but I would really applaud our previous EXCO, because I think a lot of them put in the effort for this to happen today. I'm just getting the spotlight, being pushed, but they are the one who actually did all the hard work in that context. So very much, even our IPP president or past president, even, who actually connect the pieces and puzzle for this as well.
But what you have done, actually, you did very well, because unselfishly, you all shared this session so openly. That's why I thought it's so, so useful. So I go and share like a gapo, because I thought this is topic that is so useful. You bring a doctor into a Toastmaster meeting. And this is something even you and your team had done a really, really good job.
Thank you.
So
I think
great job done.
Thanks,
Okay,
thanks,
thank you.
Betty, for the acknowledgement. I think just
Thanks,
now,
Betty.
if I see the guest that's coming in at the peak, we have 38 of them.
Yes.
Yeah. So that's really garner the attention, and I think we can actually expand. Maybe this is also a unique selling point for Venus, like mentioned by Betty. Not only communication, this is a topic that's related to everyone. Yeah.
Yeah. Thank you once again. Good night.
Good night.
Thank you
Thank
very
you,
much.
everyone.
Thanks again.